in our sectors, in post-16 education, everyone's overworked, they're experiencing high levels of stress, people are getting seriously ill, physically and psychologically, and they're getting burnt out. And we know that burnout is a huge risk for suicide as well. And we know this because there's extensive data and evidence of this harm. We've got decades worth of evidence. You and your branches have got surveys showing harm, you've got surveys showing overwork, you've got surveys showing stress. So the evidence gathering isn't necessarily the issue here. What we've got as well is we have a whole raft of health and safety legislation which places a significant number of responsibilities on employers to keep you safe at work, to identify foreseeable hazards, so they've got to anticipate what might go wrong, what might cause you stress, and they've got to prevent those hazards from causing harm to all workers and of course anyone else who comes into contact with their business. And to do that, they've got to implement preventative and protective measures that protect you from harm from work-related stress. How are they supposed to do that? Well, the law says that they have to do a risk assessment, and it has to be at an organisational level, and the reason why it has to be at an organisational level is because that's preventative. We don't want individual reactive risk assessments. We're not solving a hazard after it's already occurred. And why does the law require risk assessment? Well, it's a robust, systematic approach. Anyone who comes from a safety background knows it's really effective at identifying root causes. And when you know the root cause, you can identify a solution. And you can put in place preventative measures, protective measures, and that makes you compliant with the law. And what the law also says is that employers have to follow this preventative approach. So we often talk in safety about hierarchy of control. And I think it was Joe who was talking about physical hazards versus psychosocial hazards. And yet, employers and safety teams in your workplaces will be much more comfortable dealing with physical hazards. But once you start talking to them about stress and managing stress as a workplace hazard, they either don't have the expertise, or they don't have the knowledge, or they don't have the understanding, or they don't have the will to put in place the measures that are needed to protect you from harm. And this is a really good infographic. We've got some available at the back, but it really does show that comparison. And what employers really have to do is change the way work is done before they look at changing the worker. So we don't want to see the resilience training. We don't want to see all this well-being weeks because they're not solving our work crisis. We want to see the elimination of processes that cause extra work. We want to see a redesign of how the work is done, and we want those adjustments to be made to protect us from foreseeable stress hazards at work. How many times have we told our employers that we're stressed? How many times have you told them you're overworked? They have foreseeability. They must put in place measures that protect you from harm. But of course, we're seeing this huge gap between what the legislation requires and what employers are actually doing on the ground. And a large part of that is organisational safety culture, and some of you have mentioned this today, is that culture of overwork. I know Justine was talking about things like perfectionism, but there is this culture where, because everyone's overworked, you feel like you can't complain, or if you go off sick, you're concerned that your colleague's going to pick up the work that you're not doing, and so there's a lot of presenteeism. And so when we look at where our employers are generally in the post-16 education sector, they're at the bottom of this chart. They are not doing things and they're waiting to be caught, they're waiting to be found out, or they're reactive and they're doing things after the problem's already occurred. And we need to get our employers to be much more proactive, much more progressive, and treating safety as their everyday, and then having conversations with you openly to find solutions. And that is an ongoing process. It's not a one-off conversation that's had and then it ends there. So when we talk about using health and safety legislation to reduce workloads, we are using the health and safety legislation to collectivise that issue, and it's a really useful tool to help us do that. And one of the reasons why is that safety reps, once we've appointed safety reps, they have a significant amount of power. It's a highly underutilised role in the trade union movement, And it actually, as a safety rep, you have your own legislation that defines your role and lays it out and tells you exactly what you can do. And, I've asked some questions here. Who appoints a safety rep? The union does. Who can be appointed? Well, we decide that. The law doesn't say you even have to have training, you just have to have experience of the hazards in that workplace. Of course, we want you to be trained, we want you to be, as well trained as possible. But the law doesn't require that. Who decides what you focus on as a safety rep? The union does. What area of the workplace do you cover as a safety rep? Well, the union decides. How much time do you spend undertaking that statutory role? Again, the law says you take as much time as is needed to perform your statutory functions. So as a safety role, you've got all this power, you've got all this access to paid time off, and there's lots of within the regulations themselves, there's even recourse to employment tribunal if you're not getting that paid time off for training or to perform your role. And those roles are so well defined in the Brown Book, in the safety reps and safety committees regulations, that it's like a handbook that you should all have with you at all times and make good use of it. And so what we really want to do is be very solutions focused in our work. So you'll see today we've got organising and campaigning workshops, we've got collective bargaining workshops, and we've got workshops on how to apply safety strategies and tools such as undertaking workload inspections. And so what we really want is for reps to use that health and safety approach to reframe those local conversations that you've probably been having either locally or in negotiations for decades with little result. A lot of you have already indicated you've got workload models in place. I don't know whether they were negotiated, but either way, even if they were negotiated at a fixed point in time, and they didn't consider safety, they didn't consider what your workload would be and whether it was safe. And what instead we often see is as more work comes in, the metrics change. How much time you have to prep up gets squeezed, how much time you have to deliver teaching gets squeezed. And it's kind of, the metrics are altered. There's no conversation there about safety, about how much time it actually takes and whether you're feeling stressed. And they're the conversations that have to be happening. I just want to say as well, it's a really good time to be pushing forward this approach across UCU, because the Health and Safety Executive themselves have announced a 10-year strategy which goes up to 2032. And their first objective in that strategy is to reduce work-related ill health with a specific focus on mental health and stress. So what we're going to see, and what we're already seeing from the HSC, is increased education coming directly from the HSC, free webinars for employers on how to undertake stress risk assessments. They've updated their resources, they've updated their stress indicator tool survey, they're doing more promotion work and campaigns. So that's one piece they're doing. I've been told by the HSC that they're going to be doing more proactive inspections of education, and we want them to focus on post-16 education. After the suicide of Ruth Perry in schools, we know that they're going to be focusing on schools, but we want them to see the issues as well in post-16 education. And we know as well that there's increased regulatory interventions. When we escalate complaints to the HSC, they are now more likely to come in and investigate that issue and make sure that the employer has the proper processes in place to protect workers from harm caused by stress hazards. In this case, we're talking specifically about overwork and pace and intensity of work.